we'd obviously hoped that we would see an overall benefit across the whole patient population that we studied. That isn't the case. Overall, we see no benefit. But what is obvious is that there's a marked divergence of effect based on age and the menopausal status of these women. So the older women are gaining really quite important benefit in terms of better survival, fewer recurrences. Those recurrences are fewer at all sites of the body, whereas younger patients are getting no benefit whatsoever. In fact, they're possibly doing a little bit worse. So this means we've got to think again about the biology underpinning the effects of these bone-targeted drugs. I think what we've learned probably is that they don't have direct anti-cancer activity. They don't make chemotherapy work better, but they do seem to work on the bone marrow microenvironment when there are low levels of female reproductive hormones around, which clearly happens once a woman goes through the menopause. This population where we saw the benefit, although it was only 1/3 in our clinical trial, actually in the whole population of women with breast cancer is more than half of all patients. So this is a really important group, and often for these older patients there are fewer options for them. We need to remember that this is a very easy drug to receive, with relatively few side effects, so the benefits can be obtained for relatively little toxicity or problems.
What the ASSURE subgroup analysis of patients who are postmenopausal showed is that there is about 30% reduction in relapse of breast cancer and also a reduction in breast cancer death. So I believe it's exactly those patients well into postmenopause who could consider adjuvant bisphosphonate treatment. You know, we have to be very careful in actively recommending off-label use of drugs because there is a purpose to the regulatory process. On the other hand, we do have prospectively evaluated patient subsets, huge trial meanwhile, demonstrating a significant benefit in certain subgroups of patients. So I would understand the patient who finds herself in one of these subgroups and actually opts for adjuvant bisphosphonate treatment.